You talk about prostate cancer, as I say, as me, or as I talk to fellow people, fellow men, they're very shy about this disease. You know, you don't want to go to the doctor. You don't want to talk to nobody about this. And when I was going through it, I didn't find anyone like me that I could talk to. So my thinking was, when you say cancer, everybody think of traditionally you're gonna die. That stigma, oh, he got cancer, you got the plague. And that's how I perceived it in the beginning. But me, I just kept going forth with it. You know, I don't mind telling somebody I had it, because to me it's a badge of honor. I'm above ground and I ain't below ground. So to me, any day I'm above ground is a good day to be able to tell other men about my experience.
You know, we had these 3 DREs and I was told I was okay, when in effect I wasn't. And my feeling for a very long time is, had he recommended the PSA on my first, second, or even third visit, we would have found that I had a problem. When I did request and got the PSA, I went to see him, and he said, well, you have prostate cancer. Here are your options. Go home, think about it, and let me know. And the truth is, I fell apart. I went home, I cried, and I prayed. I knew not where to turn for advice.
The ones I had was with my wife, right? And the question was that, could it be cured and prevented? And what do we have to go through? So once we sat down and I told her what the doctor said, you know, she went with me with the doctor one time to actually get the treatment, but she didn't go when the doctor told me that I had prostate cancer. So when I went home and I told her that, she was in shock, you know, because she didn't know anything about it also. And I had to explain to her that it can be cured, but we have to work together, and it's up to me to eat right and be healthy and do the right thing. So she was very supportive.
And were you comfortable speaking to her, telling her about prostate cancer?
Yes. After 10 years of marriage, it was no problem with me expressing my fear and everything else, and how I needed her now at all times, and how this should make us stronger.
During Christmas of 2010, in the 10, we was at my house having Christmas dinner, family over, and I just got the news back in probably November. Mom was here, my brothers was here, and on Christmas Day I said, Mom, I got something to tell. All the family was here, and so I said, well, I got to tell the family. I made an announcement that I was diagnosed with prostate cancer. They know I had been sick, having some problems, but they didn't know why. So we was all at my house around the table, and I told my mom, I said, Mom, I got diagnosed with cancer, prostate cancer. And you know, you think the room go quiet, everybody go hush. But then my brother, he's 2 years older than me, he was here. He came to the table, he said, Mom, I got something to tell you. Now, you have to understand, this was a festival occasion, but this was when all the nieces, nephews, brothers and sisters, wives, everybody here. Now, he came to the table, Mom, I got diagnosed too. And when he dropped the bomb, it was more or less, I didn't know you had it. I didn't know you had it. And it goes back to this thing where we keep it all to ourselves, but he took the opportunity to share with the family.
How do the Caribbean men perceive prostate cancer?
I don't know. I've never really had a discussion with them on it. On an individual basis, I've had friends, again, from the Caribbean, Jamaica, Trinidad, that, we talk about it, but really there has never been an in-depth discussion on the subject until I had the problem to deal with firsthand.
And when you dealt with it, when you had the problem, the opportunity to deal with it firsthand, you discussed it with them, or you just discussed it with your doctor?
No, my close friends here and those in Jamaica, we discussed it and talked about the emergence of it and the prospective treatment. And it was really, that was it.
And how did they take that? How did they were they receptive to it? Were they a little hesitant about talking?
No, they were quite open. They were quite open, and and wanted to discuss and to know all that they could know about the subject matter.
Until recently, I don't think they are aware of it, to be honest with you. But recently, more of our daughters, sons and daughters, are more aware of it, and it's more publicized now. Because in the rural area, they never get sick. There's always somebody, an enemy attacking them. But now, knowledge has shown that there's what we call prostate cancer. There's what we call cancer, period. And prostate is one of them.
I did not know anything about preventing prostate cancer. I guess because most of the things that we've already heard is that so many black men die from prostate cancer. So it's almost like it's a natural occurrence.
We don't talk about it because at this time, I guess once the video comes out, people will actually know that I have prostate cancer, or I had prostate cancer, because it's been 2 years and I've been cancer free. But at this time and any other time, I never talked about it as I was going through the process. I never mentioned it to no one but my wife. So I really didn't have nobody to tell me about it. I had to do research on my own. That's why I'm trying to be an advocate for prostate cancer, to let other males know what I've been through, so maybe it can make it easier for them.
From my experience, people perceive prostate cancer like I did. It was someone else. I didn't know no one who had prostate cancer till I got diagnosed. And when I got diagnosed, I met people looked like me who was diagnosed. But before then, I ain't know nobody.
I discussed it on my next visit to my GP, general practitioner, and requested a screening. And that's when I had my first screening, 94, which was the DRE, the glove finger test, which a lot of men will not deal with. They are afraid of it. And I think it's, foolish not to overcome those fears, because it can prolong your life.
You're supposed to go to make a check, but I scare. Why I scare? Because they tell me I have to do the GRE. The GRE is a digital rectal exam. So I scare it. And many Asians scare it too. That's why they take time to do it.
I wouldn't say I was comfortable.
What would you say?
I just say it's something I have to get done, whether I like it or not.
It was necessary.
It was necessary.
Why?
To survive. And to survive is to be able to continue to support my family, and also to inform others about it. That it's a little scary, but once you get yourself in there and get comfortable with what you need to have done to you, it relaxes you.
Discussing with my mechanic, bending down for a doctor to stick their hand in your anus to feel it, whether it's smooth or it's not rape, they need to be educated. Some of them feel they are raped. You are not being raped. They are just examining your prostate. And if it is smooth, they don't need to do anything, fine. But if it is not, the earlier they get it, the better for the person.
Medical people have been talking about whether or not certain types of treatment are really necessary, and so it seems to me that although prostate cancer has been around for a long time, that a lot of the medical people and scientists are still treating it as they don't know what the answers are. They're still groping to find a solution. So, I don't know. I just have to go with what's on the table.
You're somewhat baffled. I mean, here is something that you have not experienced before. You do want to make the right decision. The way I was set up was I had doctors from different areas of treatment to talk with me. Mm-hmm. There was a surgeon, mm-hmm. There was an oncologist, mm-hmm. and there was one other person that did the urologist. Mm-hmm. Yeah. So all of them will talk with you, and of course they have your history in front of them. Mm-hmm. They will try to help you make the right decision. However, surgeon, of course, he's promoting surgery. And the oncologist gives you other options. The final analysis is kind of left up to you, depending on your family history, mm-hmm. or your state of health.
My doctor advised me to get a second opinion. As a matter of fact, he insisted that I do a second opinion so I would be able to be fully informed, not just taking his word. And it is my understanding that this is not a common practice. Most of them give their opinion and state that that's what it is. But my doctor was one of those doctors that I've been with for a while, and he insisted that I get a second opinion, which was very good. He says that I want you to do what you need to do to make sure that we'll be able to take care of you. And to me, those were real nice, comfortable words that fit into my situation. I want to be able to take care of you. So that way, when he's telling me that, he's letting me know that he has concerns with my health. So with me having the necessary concerns, then I'm going to do what was necessary to make sure.
And how important was it for you to feel that from him having concern for your health?
It was very comfortable for me to know that he had a concern for my health. Like I said, I had been dealing with my doctors for a while, and knowing that and getting the information that I got from them made me feel very comfortable. It did not make me feel just like a patient. It made me feel like I was a friend. I was somebody that they cared about.
My physician told me, okay, 6 months to a year, you'll be back to normal. That's what he told me. 6 months to a year, you'll be back to normal. He kept preaching that. He didn't tell me anything different. He told me 6 months to a year, you'll be back to normal. And so when I went into surgery, with that in mind. Doc, you got to, 6 months to a year, you'll be back to normal. Okay. And you won't have that problem.
And how long was it?
It's still ongoing. It's almost going on 5 years. And it's not back to normal.
I'll stay with them because they've been very sensitive with me. They've been very patient, and they've been very good to me. My primary doctor and the urologist. My primary doctor, matter of fact, I owe his life to him because he's the one that find the cancer on me. I never had any pain. I never had nothing. But he's the one who find it because, like I told him, I say, you too nosy. And then that's why that's why he's good, because he's nosy. He takes his time with his patient.
My doctor advised me to get a second opinion. As a matter of fact, he insisted that I do a second opinion so I would be able to be fully informed, not just taking his word. And it is my understanding that this is not a common practice. Most of them give their opinion and state that that's what it is. But my doctor was one of those doctors that I've been with for a while, and he insisted that I get a second opinion, which was very good. He says that, I want you to do what you need to do to make sure that we'll be able to take care of you. And to me, those were real nice, comfortable words that fit into my situation. I want to be able to take care of you. So that way, when he's telling me that, he's letting me know that he has concerns with my health. So with me having the necessary concerns, then I'm going to do what was necessary to make sure.
And how important was it for you to feel that from him having concern for your health?
It was very comfortable for me to know that he had a concern for my health. Like I said, I had been dealing with my doctors for a while, and knowing that and getting the information that I got from them made me feel very comfortable. It did not make me feel just like a patient. It made me feel like I was a friend. I was somebody that they cared about.
So I went to his house one day, and I said, doctor, I said, look, let me tell you something. I'm not in your office now. I remember one thing, I'm older than you. So whatever I ask you to do now, you will do. When I come to your office and you are my doctor, I will obey you. Now I'm an elder, you must obey me. It's okay. I said, get up, come and sit down here. And I sat down there. I said, now, you are the patient. I'm now the doctor. What will you do? He said, no, I can't treat him like that. Yes, I can treat you like that. I'm older than you. I said, what will you do? You have prostate cancer now. I don't. I'm doctor. If God has healed in the past, he can heal you now. I believe that miracles still happen. But I also believe there's medical knowledge that we must tap into.
Had my urologist being fair, he would have suggested that I go for a second opinion, and I could have gone to another urologist or an oncologist. An oncologist is where they treat you with, other modes of treatment. A urologist is a surgeon, and his or her job is to cut. So here we go. He's going to cut into me. And one of the things I came to dislike about my urologist was, on my visits, he would say, well, on your next visit, if your PSA is still rising, I am going to do this, I am going to do. I was never included in the decision making. And for the first few years, I didn't have the guts to say, well, goodbye, since I'm not included, I'm going to go where I am.
One of the things I found out now is it ain't no stupid question. You ask and you ask and you ask till you get the answer. I found out they don't like it, but I make it clear to them, I don't understand. Can you, I have a tendency to tell the doctor, can you talk a little down to my level in English? And they'll laugh at it. You make a joke of it because, one, we have a tendency, we don't want to offend the doctor. We don't want to hurt their feelings. We don't want to get a second opinion. Here's the problem. This is your damn health. You can't worry about offending them. There's only two things going to happen. They're going to either say, I don't want to see you no more, or I'm going to refer you to another doctor. At the end of the day, you must ask those questions. If you don't understand, I'll repeat it again. If you don't understand something they're saying, raise your hand. Excuse me, sir. I know you done said it, but help the old dog out. I don't understand.
Trust me, you will be okay. You'll fight through it. I am fine. I'm 45 now. I feel great. I can go to the gym and work out with the big dogs. Trust me, I can. And that's after me having prostate and really lost everything. I have no strength or none of that. But I work myself back up where I'm at. I feel great. It can happen, guys. Trust me on this.